This meeting is being recorded.
You can proceed.
Yes, thank you so much. Very good evening, everyone. I'm Dr. Venkatesh Karthikeyan, MD Community and Family Medicine Postgraduate Resident from AIIMS Patna. I'm glad to know that around 300 plus doctors, as you all know, healthcare workers have been at the front line in the fight against the COVID pandemic and faced a substantial risk of infection during the COVID-19 outbreak. Beyond the risk of infection, pandemics and outbreaks have a psychological impact on the healthcare workers. In addition, healthcare workers worked for long hours, suffered from scarcity of personal protective equipments, and had to face difficult situations such as deciding which patients to treat after resources become limited. These difficulties resulted in adverse mental health outcomes that were not only detrimental to the healthcare workers' well-being, but also posed a threat to reduce their ability to address effectively the health emergencies. Moreover, psychological distress among healthcare workers has been shown to be associated with a range of psychopathology, including serious life-threatening behaviors such as suicidal ideation. Several studies showed that a significant proportion of healthcare workers has symptoms of anxiety and depression, and the change in perception of patients towards healthcare workers in the recent days has worsened the situation much more. This is evident from the recent incident of suicide of Dr. Archana Sharma ma'am, who was a gold medalist and a successful physician. This sad incident has once again emphasized the importance of mental health for healthcare workers, especially doctors. Understanding the dire need of stress management amongst doctors, IMA Junior Doctors Network and FAIMA is organizing this webinar under the leadership of JDN Chairman Dr. Srijit Sir, JDN National Secretary Dr. Parul Ma'am, and National President of FAIMA Dr. Rohan Sir. We have an elite group of panelists with us like Dr. Divendra Bhushan Sir, Faculty of Medicine from AIIMS Patna, Dr. Rafia Khan Ma'am, who is an anesthetist and national spokesperson of FAIMA as well, Dr. Aprajita Singh Ma'am, Psychiatry Resident from Mahatma Gandhi Medical College, Jaipur, and Dr. Shanki Kumar Ma'am, Head Psychologist of BL Kapoor Max Hospital, Delhi. Dr. Rajendra Damija Sir, Director of Institute of Human Behavior and Allied Sciences, New Delhi, who is supposed to join, has got some emergencies due to which he will not be able to join. But however, we are having a very dynamic group of panelists with us today, and I take immense pleasure in welcoming them all. So first, I would like to request Dr. Divendra Bhushan Sir to give the opening remarks and start with the presentation. Sir, you're muted, sir.
Good evening, all. It is my immense pleasure that we are in a platform where all healthcare workers are there, and the topic chosen by the Dr. Venkatesh and the team is very apt at this during this time, especially one bad incident which happened to our fraternity. And I welcome all my colleagues here, Dr. Aprajita, Shanki Kumar. So I think I will give a small PPT presentation, and then we can discuss and we can take the questions from the viewers also. So can I proceed with the presentation, Venkatesh?
Sure, sir. Sure, sir. Please do, sir.
Okay. Is it visible?
Sir, not it, sir.
It is not visible, Venkatesh.
No, sir, it is not. Yes, sir, now it is visible.
Now it is visible.
Yes, sir.
So, stress among the healthcare worker is I think healthcare workers are, they are trained to deal with the stress. So stress is nothing. What is stress? Let me tell you, but in a language, if we can define it. So stress is a physical and psychological condition of our body and mind. and it is not an action. So it is a situation, event, and people do not cause the stress. So somebody cannot give you stress until you don't want to take it. So this is not an action. This is a reaction. This is the reaction of our body. So it is our perception, attitude, values, belief system, and reaction to situation which leads to stress. So it is, we have to modify, we have to train ourselves to deal with the stress. So generally when something happened in our life, some incident happened, something happened to our day-to-day activities, that stressor come, and that perception of threat come, that if it is not going to be smoothly gone, then what will happen? If it is not done, then what will happen? If it is done, then that is a different thing, but it is not done, then what is it? So that perception of threat is always there. And then the emotional reaction occurs. So stress, generally, when we talk about stress, it is 90% time it is in the negativity. But let me tell you, stress, some amount of stress is said to be very good for growth of our career. It is said that stress is a progenitor of success. So some amount, but it should be a some amount of stress only, not like that it gives the negative impact on you. So what stress do to us physiologically? It can give many symptoms like muscle cramps, pallor, fist gripping, shakes and tremulousness, dilatation of pupil, tachycardia, tachypnea, stammering, and dryness of lips. We used to see such kind of things in our OPDs and in our colleagues whenever they found any abnormal situation. Psychologically, they can be affected by effective behavior like fight, decisiveness, problem solving. Now how to deal with this is more likely psychological part in effective behavior or avoidance behavior. Either we have to take it positively and show that we can solve that problem solving behavior, assertiveness. We can make the goals, small goals to achieve the hurdle. We can engage in, we can make our timetable, we can schedule the things, we can make ourselves engage, and we can use the humor, music, and lyric music for entertaining us. So we can change our behavior. And avoidance behavior, that when something happened bad to us, we just avoid it. कि नहीं, ये मेरे को ये नहीं करने का है ना, मेरे को उस पर ध्यान नहीं देने का है. So see, the avoidance, stress is something, stress or something, some task is something that you should not avoid it. You should face it, because it is not going to be, it is in one or another way, it will come again in front of you. So avoidance behavior should not be there. So the coping mechanisms of stress has two divisions. One is cognitive and other is behavioral. So in cognitive mechanisms, first thing we have to realize that stress is a fact of life. We cannot eliminate it from the every day you wake up and you find, आज तो मुझे ये करना था, ये नहीं हो पाया, आज मुझे ये करना था, ये नहीं हो पाया. So this is the common thing. अगर कहते हैं ना कि अगर कुछ नहीं भी होगा तब भी आप परेशान रहेंगे, तो परेशानी तो जिंदगी में आनी ही आनी है. So we cannot eliminate this stress from the life. अगर बड़ी चीज की स्ट्रेस नहीं है तो छोटी चीज की स्ट्रेस हो जाएगी, अगर छोटी चीज की स्ट्रेस नहीं तो उससे छोटी चीज की स्ट्रेस हो जाएगी. So this we cannot take out from the life. Take preventive measures. अगर जैसे कि let me tell you, जैसे कि हम अपने बच्चों को बताते हैं, अपने स्टूडेंट्स को बताते हैं कि preventive measures. What will the preventive measures? कि अगर प्रॉफ होने वाला है 6 महीने के बाद, तो start reading your books. Start seeing the patients in the ward. So we have to make them prepare for the forthcoming exams. This you should do. You should activate yourself. You should do more and more exercises. You should do more and more repetition, and learn to manage the how we will, if something happened to us, then how we will manage this burden. So stress inoculation. Next thing is stress inoculation. This is a word which says it has three phases: educational phase, rehearsal phase, and application phase. In educational phase, we see that if a problem comes to us, we will see it as a problem. It see as a question mark to us. What will I do? Now, my question should be that if my car got accident, then now what will I do? So without getting panicky, I have to see कि अब मुझे इसको I have to take it to the garage. तो मुझे सीखना है कि मुझे जाके इसको गैराज में देना है, ना कि पैनिक होना है मुझे. अगर मैं if I am saved, I have been not been injured, so the thing to repair is the car. It is nothing else. रिहर्सल क्या है कि मुझे आगे से मुझे ये एक्सीडेंट ना हो. तो I have to see whether I was driving rash. मैं क्या गलती कर रहा था, what mistake I was making. So rehearsal phase and then application phase. If I was on the fault, then I have to be cautious next time that I should not break the rules of traffic. So this stress inoculation make our life simple later on. It is like a vaccination, what we do in our practice. Cognitive restructuring, in which we have seen that there are times that we talk to ourselves, self-talk. I have to do this thing. I have to crack the MBBS exam, or I have to get the promotion. Let's talk about the health. If we are talking the healthcare workers only, I have to get the promotions. Or in the corporate world, I can say I have to achieve this much target so that I can achieve the next level of the my salary hike will be done. So usually we talk to ourselves that what goals we have to make. So there is a self-talk. So we have to try to talk to ourselves. Yes, what in positive sense, what we can do to progress ahead. We have to think about negative to the positive self-talk. मैं नहीं कर पाऊंगा से कोशिश करता हूं मैं कर पाऊंगा. Let me try. With myself, with the help, with somebody taking some suggestions, asking someone, but I can do it. So negative self-talk, we have to come further to a positive self-talk. So this we have to do in our mind. Most of these are due to the beliefs. Let me tell you, in our time, as we can say, the hard work is supposed to be, we used to be key. Simple example, if I can give that, there is a word called ragging. A few days back, I was reading an article which says that absence of ragging causes this much of stress in our life, that the people in our professional are not able to deal with the stress as they are not undergoing the process of ragging. So this is a belief. So this is not so. So if there is a belief, disputing the irrational belief is the first thing to de-stress you. So there are stress due to the strong beliefs. So those beliefs has to be modified. You have to ask the questions. You have to give the emotional and behavioral consequences, and this will affect ultimately your coping mechanism. Accept the responsibility for yourself. Take the responsible stance in work situation and be ready to face the consequences. If you are a junior resident at some place, I used to tell my students that if my JR, the postgraduate first year, is not able to write a detailed prescription, it is forgiven for him. But if it is not done by the JR3, it is not forgiven for him. So there are stages of the growing up. We grow day by day. We take experience. So the person who is for first year can do some mistake from my side, but I am there to check it. I am there to check it that he will not harm my patient. He will not harm his patient. So there is a team, but he is allowed to do it. At least it is a learning phase. So, but he should take the responsibility of himself, his work, that yes, this is my work. I have to do it. I will ask my seniors. I will talk to my colleagues. I will talk to my consultant, and then but the responsibility is mine. Past unfortunate events should not be carried along. Sometimes some mishaps happens. We should learn from them. That negative. If we fail something, we should learn what mistakes has been what mistakes we have done, what was the deficit in our hard work, what was there. So we should learn, and we must shun learned helplessness. We should avoid all those things that we are helpless, and we should focus on now at present what is going to happen, and make choices ready for the consequences, and do not blame others for your failure. This is the one thing which I says to my all postgraduates, that if the patient deteriorate, it is all my responsibility. So that's why if anything happens to the patient, let me all my responsibility. So to do the best, it is very important to communicate with your seniors. Am I audible, Venkatesh?
Yes, sir, you are. You're audible.
So accept that you are not in the control of the world. At least when you are grown up, when you are beyond your 18, 20, 21, you are in the postgraduate. In our profession, you are mature enough, you are educated enough that we as a consultant don't think that you will not harm, at least you will not harm a patient. It is our duty that we will teach you further, and we are in that process also. But that maturity comes with a time, event, and people will not follow the course of action you want. They are so all people will follow their courses. So every event is not under your control. Attempt to change people and event are self-defeating. When you want to change someone, it says that you cannot show him what is good or what is bad. So don't spend your energy on the people to change them, that you are doing wrong, you are doing wrong, you are doing wrong. No, let them do it. And you show the correct method. They have to learn that yes, they have to see that I am doing wrong and he is doing right. You don't say that yes, you change yourself. No. And accept that you cannot change, and rather change yourself. You cannot change others. It is the easiest path that you change yourself than changing others. So before helping others, you should help yourself. So we should follow that I am okay and you okay, rather than you are okay, so I am okay. So me first. You should be okay. Stop perfectionistic attitude. So this says that do not accept mediocrity in your life. This is what the stress will give you. Try to achieve more and more higher and higher steps further. You should be good in your work. Make success as your goal and not the perfection. So the target should achieved with a positive mind, not that by harassing someone or showing that it is done in this manner only. You should not be stick to something. Achieve as per your ability and situational constraints. Everything is not definitely not under your control. Accept that you may not be the best and give the credit to all your subordinates, your colleagues, which helped you in achieving your goals. Now cultivate the spiritual intelligence. This is something which is nowadays it is very common. I'm just few days back, I got to know that there are many small groups in medical colleges which are ISKCON followers. So they are spreading the spirituality among the medicos. So it is very good. I think art of living. There is something beyond our control, that we should be flexible enough. We should know that we are human beings. We should know our self-awareness should be there. An ability to face and use sufferings. This term basically comes when we usually see the oncology patients. A tendency to probe and ask fundamental questions. मैं कैसे खुश रहूंगा? मैं कहां तक मुझे अचीव करना है? How much salary I want? In which car I want to go? What do you want? What I want at the age of 60? So we have to think about ourselves. The ability to be inspired by vision, an ability to work against the convention, it should be, an ability to see the connection between the diverse things. There are no explanation for everything. खासतौर से मेडिकल में कहते हैं ना हम लोग, जब मरीज या आस्किंग क्वेश्चन ऐसे ही होता है. क्यों होता है डॉक्टर साहब? ऐसे ही होता है. So think holistically. There are things which are beyond our knowledge. We can say idiopathic. Now come to the behavioral mechanisms. This behavioral things, I think Madam Shankya will be tell us better. But a few slides about the behavioral mechanisms. Time management. This is the very important, which I used to say in our junior resident also. Set your priorities. When you come to the college, when you come to do the post graduation, there are two, three things which you have to do. You have to study hard. You have to study Harrison in the if you are doing a post graduation in medicine, you have to see the patients. You have to manage the emergencies. So set your priorities. What I have to do in 3 years, and complete assignment at your time. Your time management should be good. Limit telephone calls. This iPhones, Android phones, these are very good, but at times they are just useless. Regulate the visitors. Stop unnecessary reading. Limit meetings. When whichever is necessary, do it. Otherwise, leave it. Organize and reorganize your work environment. How can you make out best out of waste? Get out of workplace one day in a week. So you will see, okay, let me plan next week what I have to do this. So time management is one thing which we all should do. Management of habits. So habits are not a one-day job. Habits form in years. So they are not just they're not changed by sheer willpower. It demands change in belief and attitude, and it requires practice. We should make a to-do list, and one thing is that we should target our habit. Suppose I target habit means I have to connect the habits. Like say, if I don't exercise, if I don't run, then I can make a habit कि मुझे brush करने से पहले morning में I have to take a round of my colony, 2 rounds. So this is I linked it with my brushing. So until or unless I will brush, I will take 2 rounds of my colony, and then I will be doing my brushing. This will hinder in my mind. If I don't do today, it will hinder in mind. मैंने आज नहीं किया, मैंने आज ब्रश, मैंने आज वॉक नहीं किया. So this change in habit takes time, but we should, it require practice. We should do it, and it needs reinforcement. In fact, we do in the rewards or punishment, which we can do. If I have not take round 2 times round, then I will not take my bread today in the breakfast. I will eat only, I will take only the soups. So this should be reinforced. Engage regularly in leisure activities and physical exercise, sports, painting, cycling, drawing, music, whatever you like, you should include. Why you left your leisure time for others? You use your leisure time for yourself. आज अच्छा नहीं बनाते हो, कल अच्छा बनाओ. There are many of my friends. Even nowadays, I am doing I rejuvenate my painting activity with my daughter, my 8-year daughter. I am doing paintings once in a week. So take out time for your leisure activity. Everyone has this. Be assertive to say, learn to say no. This is very important. When you, for a healthcare worker, see, the healthcare workers are the most vulnerable. They cannot say no. No? Doctor Sahab, the phone will ring at 5 o'clock. Doctor Sahab, can I come now to your clinic when I am planning to go out? Can I come to you, show my reports? And there will be a bunch of reports I have to see, I have to prescribe. No, I have to say no. It is my time that has been gone. My visiting hours for the patient has been gone. So you lost your time. So no, you start saying no. So in a polite way, in a way that should be assertive, that should not be aggressive, and passiveness should not be. कि हम देखना नहीं चाहते थे. We should learn the difference between how we communicate, assertion, aggression, and passiveness. Accept and identify your personal rights and rights for other persons. So if I am taking care of my rights, I have to take care of rights of my junior resident also. They have their own right. They can say no to me. So reduce obstacles to acting assertively. So I used to say to my postgraduates, अगर मेरी किसी बात से बुरा भी लगता है, अगर मैं कहता हूं कि नहीं तुम्हें आज नाइट ड्यूटी करनी है और तुम्हें नहीं करनी है, let's say सर मैं नहीं कर पाऊँ, I will arrange someone else. But this thing should come. अंदर ही अंदर परेशान होने का नहीं है. You have to say no. Sir, I am busy, I am tired, I cannot do. Please arrange someone. या फिर I will arrange someone. So this learning of say no is very mandatory. So your self-care is always a valid excuse to say no. Self-care is very important. Take proper food. Take lots of vegetables, green vegetables, carrots, whatever if you want. If you are a non-veg, take fish, whatever you like. So take care of your feet. It should be not like आज तो मरीज देखते देखते ही मेरा lunch skip हो गया. No, you take your time. You are earning for yourself. So you enjoy your lunch, you enjoy your breakfast, you enjoy your dinner. Working gradually and authentically towards generating support from others. So your काम करना है, अच्छे से करना है, और we have to support system से करना है. As we are doing in a government setup, there are teamwork from the JR, sisters, residents. So there is a whole team. And in the home, we have a team of our family. My wife, my spouse, my parents, my kids, they are all the support system. My family, my friends. If I don't go for the work, my friends continue to ring at 5 a.m. अरे यार तुम चल नहीं रहे. So develop a support system for each other. Act as a problem solver. So take the problem as a how to deal with it. Focus on it, how to deal with it. Avoid behavior multiplies problem. Avoidance behavior should be should not be there. So we should act in a problem solver manner. Goal formulations and achievement, like define your personalized goal in terms of being meaningful, measurable, and realistic. So we have to decide about the 5W and H, that is who, why, when, where, and what, and how. हमें कौन चाहिए, कौन क्या होगा हमारा, क्यों करना चाहते हैं हम काम, कहाँ करना चाहते हैं, कैसे करना चाहते हैं, और कैसे होगा ये. So this questions has to be answered by ourselves. This give you how to achieve the next step of your goals. Develop steps to reach a definite goal, like whatever though your goal is. Primaries, you have to achieve, you have to crack the post-graduation exam, you have to give the DM exam, you have to go for a fellowship, whatever your goal is there. You have to open a IVF center, whatever your goal is. So decide it. Indulge in the music and lyrics. So these are other extracurricular activity, and this will soothe you. And in the treatment part भी हम जब देखते हैं तो देखते हैं कि music has a very good role. Even in the OTs, my surgeon friend says, when the music is going on in the background, patient relaxes better than when the music is not running. So there are the trials, and there are the trials which says it is background music helps the patient to de-stress himself. Indulge in humor and laughter. There is nothing in the world so irresistible, contagious as laughter and good. And कभी-कभी चुटकियों में चीजें निकल जाती हैं कि अगर कोई परेशानी में होता है और अगर आप सामने बैठे हैं तो ये ह्यूमर और लाफ्टर ही उसको एक सॉल्यूशन दे जाता है. तो we should be open, and we should not take it as a pain. Anything we should not take it as a pain, and we should search what are the solutions of the problem. So this is all about the stress management in the healthcare worker. I think we should give wings to the stress and let it fly away. Thank you. Thank you all.
Thank you, sir. Thank you so much for the elaborate, extensive, and wonderful presentation, sir. Sir, like you were telling about the coping mechanisms in a wonderful way. I just wanted to know, as an individual or as an healthcare worker, there is some cutoff after which I really needed medical help. I needed a help from a psychiatrist or a psychologist. So at what time, what is a red flag sign that I should approach a psychiatrist? I would like to request Aprajita ma'am to throw some light on it.
Thank you, Dr. Venkatesh, for the question. So everyone has a different threshold for the stress they get. So red flag will, according to me, differs from person to person. But yes, if there is chronic stress, and if you're feeling something that we call burnout in doctors, that is when you should reach out. If you start having mood symptoms, if you start feeling low for most part of the day, if you are feeling there's fatigue, if you're feeling the fatigue, if you're always stressed, if you're feeling restless, if you have disturbed sleep all the time regarding just one situation, then I think if it goes on for more than 2 or 3 weeks, then in that case you should definitely reach out to any psychiatrist or psychologist as per your need, or any which way that you desire, like whoever you want to reach out to.
Thank you, ma'am. Thank you. So, and many a times, even I have referred a few of my friends to psychiatrists. Those psychiatrists have a crucial role in diagnosing as well as managing the patients medically. But most of the counseling part is done by psychologists. So, I would like to request Shanki Kumar ma'am to share her experiences in counseling healthcare workers, especially doctors, and how does she counsel the doctors and especially medical students and postgraduate students. Over to you, ma'am.
Thank you so much for the question. First of all, I'd like to say, Bhushan sir, that was a fantastic presentation. I think you covered it all really beautifully. And answering your question, Dr. Venkatesh, I think an important point in counseling doctor or any person is to understand a doctor is as human as everybody else. Just because you're in the hospital, you're there to take care of the patients, to provide support. It does not mean you don't get hurt. It does not mean you'll not be anxious, you'll not be stressed. Rather, imagine the kind of burden and the kind of pressure one person has when they have the responsibility to take care of so many people. So I think first of all, understanding them with as much humanity as someone else continues to be the first thing. And second of all, like Sir rightly said in the presentation, I think being in the healthcare structure, it feels like you can't say no to people. So you actually overstretch your boundaries. You stop prioritizing your own self. You take care of that self once you've reached an extreme space where it's impacting you so much, like your normal functioning impacts. Like Aparajita ma'am was saying, that if the problem continues for 2-3 weeks, that is when you understand that this has gone beyond. This needs to be addressed now. So I think when I'm counseling doctors and more healthcare workers, why just restricted to doctors, all the staff and everybody who helps to run healthcare organization, the first important thing is number one, take care of yourself. If you are less anxious, if you are more positive, you'll be a better doctor. You'll be a better person in that space. So, number one, you prioritize your own space by taking enough breaks, by making sure that in the evening you do a self check in. How am I feeling today? Is there something that's impacting my mind? All the traumas that a healthcare worker goes through stays in their mind. Sometimes in the evening when you're relaxing, you'll get a flashback from what a patient said. So I think learning to switch off after work is very, very important. But of course, in the balance that you understand, you will be there who will be actually addressing urgent situations as well. So balancing the two continues to be a paramount factor.
Thank you, ma'am. Thank you so much for the wonderful answer. Devendra sir, I would like to come back to you. Sir, in day-to-day practice, you would have been handling difficult patients and difficult attenders, and we can see a steep rise in increase of violence against doctors. So, how do you think, as a postgraduate resident and as a junior doctors, we should handle such kind of difficult attenders and patients, sir?
Any questions for the postgraduate and those who are dealing patients in the corporate or private setup? I have worked actually presently I am working in a government setup. Before that, I have worked quite a years in the private setup. So it is very important, Venkatesh, it is very important to communicate with the patient and patient attendant. It is very important. So what I say to my uh, junior doctors or postgraduates, that once you saw the patient, take out some objective means there are various scores. Yes, various scores for every disease, which will tell you what is the prognosis of the patient. I used to say them that you calculate it, and in an objective way, you just explain the patient. What is the nature of the disease? What is the chances of survival? What is the chances of recovering? What disability he or she may have after that during the process. So explain them as objective as much. And once you saw the patient, it is almost say in first 24 to 48 hours, we are able to most of the patient, we are able to formulate that this kind of disease he is suffering from. So we give a broad idea to the patient attendant and give them a disease, explain them about the disease nature, and take in the writing also. This is the most important thing which I used to do when I was there in the private setup. Now here my residents are doing it, and this is quite useful. They know that this has been explained to me or someone, because it happens quite often that one attendant comes today and he just worked out tomorrow. And the new attendant comes. He says that मुझे तो कुछ नहीं बताया. This happens in a day-to-day practice. So मुझे तो कुछ नहीं बताया. We have explained to you on paper. This is the nature of disease, and it is with the patient file. So this is important. This is very important nowadays, especially in medicine. As we are looking after medicine ICU, we are doing for all patients. In ward also, we are having quite sick patients. In those patients, we are maintaining it. This is very important to explain the nature of the disease and this will definitely decrease the aggression of the patients attendant, because they are anxious too. They want to know ठीक हो जाएगा. उनका सिर्फ एक ही क्वेश्चन होता है, ठीक होगा कि नहीं. चाहे आप उनको ये भी बता दो कि अगले 2 घंटे में पेशेंट एक्सपायर हो जाएगा, ठीक होगा कि नहीं. मतलब माइंड में भी कि we they are in the that neuronal block. They cannot think about that कि ऐसा भी हो सकता है कि मेरी वाइफ, मेरा बच्चा, मेरे फादर एक्सपायर भी हो सकते हैं. दिस इज द स्टेज ऑफ डिनायल. दिस इज द स्टेज ऑफ डिनायल वेयर सेज कि नहीं, ऐसा कैसे हो सकता है, कल तो ये बिल्कुल ठीक था, या अभी तक तो ये ठीक था, ये कैसे हो सकता है. It is a human nature basically. So we should be dealing it professionally by explaining them proper prognosis in a written way.
Yes, sir. Thank you, sir. Thank you for the brief explanation. Next, I would like to invite Rafia Khan ma'am. Ma'am, you are working in a very stressful branch, that is anesthesia and critical care. Plus, you are the spokesperson of one of the active organizations, that is FAIMA. So, balancing between these two, how do you manage? How do you keep yourself away from stress, ma'am?
Hello, good evening, Dr. Venkatesh, and good evening to all the respected panelists. Dr. Venkatesh, your question is really a bit tricky. Though, yes, of course, I do work in a very stressful environment. ICU is a workplace where you cannot just leave the patient. Like, it's very stressful. There's so many factors. Residents are working under a lot of pressure. The patients are really critical, and the patient requires 100% of it. I think more than 100%. So balancing between the two, between being a spokesperson of FAIMA and also working in a very stressful environment, it takes a lot of my, what should I say? Of course, there's at times, yes, there is this balance between the two. I really find it hard to manage between my home, my hospital, plus with my organization, because I feel if I don't give 100% to my patients, it will be unjust on my part. If I don't give 100% to my organization because I'm fighting for the cause of doctors, then it will be unjust to my part. And also, it will be unjust if I don't give 100% to my family also, because they also want my time. So it's really difficult, but yes, as Sir has rightly said, time management is really important these days. When you are engaged in so many activities, I suppose everyone today, especially the doctors, they're not just engaged in just patient activities; they're involved in various other activities. So I think time management is one thing which we should practice. We should prioritize our things. Like, okay, I need to see my patients. These are sick. I'll give this much time to my patients. Okay, my organization needs this time. Itna time I have to give it to them. Itna time I have to give it to my family. And like Sir has rightly said, it is very difficult for doctors to say no. But yes, we need to eventually, we need to practice to say no. Until unless we practice to say no, we'll just, I think we'll miss out on we'll just miss out either on one of the things, your family, your organizations, your habits, your extracurricular jobs, or you'll have to sacrifice on your patient part. So time management is one thing which is very, very important. And I actually try to practice my best. I prioritize on a daily basis. What is like, obviously, I am going to hospital, and I know that after my hospital, obviously, I'll be so much drained out. I'll be so much exhausted. But yes, there are more jobs waiting for me. So how much time I need to give here, I need to give there, I just prioritize. So I have my list every day. My list is ready. Okay. So it's just a tick thing. Okay. This is done. This is done. This is done. So at the end of the day, I feel satisfied that most of the jobs, at least I try to complete 80 to 90% of the jobs which I set for myself. So I feel satisfied at least when out of 10 things, if I'm able to complete 7 to 8 things, so I really feel satisfied with that. And I would like to advise to my juniors also that time management is really important, because until unless you do this, you practice this, it really becomes it becomes very difficult, and at the end it will be you who will be exhausted and drain out, and you will not be able to cater your various demands. No, you won't be able to serve your family also. It's very important.
That's very inspiring, ma'am. Thank you so much. Uh, Ma'am, next I'd like to ask Shanti Kumar, ma'am. Ma'am, in your rich experience, how commonly you listen to cases of burnout, that too, especially in healthcare workers like doctors, nurses, and other paramedical staffs, and how do you counsel them? So, what are the key things which we should keep in mind in order to avoid burnouts as healthcare workers?
I think it's very, very frequent that you meet people working in your organization and otherwise to reach a space of burnout. One very important thing, which I want to tell everyone, is try and quantify your experience. Look at this burnout or stress on a scale of 0 to 10. Majority of the people will come and speak to a psychologist or the psychiatrist once they've reached a 9 on that scale. मैम ऐसा हो गया है कि नींद भी नहीं आ रही है, बहुत परेशानी भी हो रही है, मतलब कुछ भी नहीं कर पा रहे हैं, आप बस सब कुछ ठीक कर दो. So they come when it's become urgent. They've made it a firefighting situation. Fire लग गई है, please हमें extinguisher देके जल्दी से fire extinguish कर दीजिए. But it's not a magic thing that can just be done like this, right? It is very, very important, which I tell everybody. See how you're feeling on a scale of 0 to 10. 0 means maybe no stress at all. You're feeling very happy and content and gratitude in your life. And 10 means I've reached a space that I'm not even able to do my normal functioning. By normal functioning, I mean waking up, going through my day, doing my work, feeling good about my work, eating my meals on time, sleeping on time, all these things. The moment you reach a scale of a 4 or a 5, please take care of yourself. Don't wait for it to become a 9 or a 10. कि अब करेंगे कुछ. So I think that for every person, doctors, healthcare workers, everybody else, analyze yourself on a Sunday. Make it a Sunday self check-in. Sunday evening, when I make my to-do list for the week, I also want to check in, how am I feeling? How was this week for me? Is my sleep okay? Did I eat properly? Am I feeling as hungry as before? Did I do something for myself? So that little bit of self check-in is very, very important. Second important thing, I think एक बहुत बड़ा stereotype जिसके साथ हम बड़े हुए हैं कि to do list में सिर्फ काम की चीजें होनी चाहिए. 11 o'clock patient, 12 o'clock meeting, 1 o'clock this. To do lists are not only about work. In your to-do list, put 2 bullet points for yourself also. I want to take a half an hour walk. I want to go for a swim. I want to take my family out for something. जब आपकी टू डू लिस्ट में आपकी पर्सनल एक्टिविटीज भी आ जाएंगी, आपकी सेल्फ केयर एक्टिविटीज भी आ जाएंगी, they will become as important as your professional commitments. And that is where self-care begins. And that is where you will not reach the burnout stage sooner. Now imagine that every instrument that we use has a shelf life, right? सबका एक डेट होता है कि इतने आवर्स के लिए ये लैपटॉप काम करेगा, फिर चार्जिंग पे लगाना पड़ेगा, right? So let's not put our charger on when we have 5% battery. Let's try and put the charger on sooner. So a self check-in every Sunday. Analyze yourself on a scale of 0 to 10. Number 2, point your personal things in your to-do list as well. They are as important. Stop giving them lesser priority. And point number 3, communicate more clearly. I think in healthcare setting where you have the support of other doctors also, talking to your colleagues, discussing it with your colleagues will make you feel very heard and a part of a group. So if you follow these 3 things in your daily practice in a weekly manner also, you will see that your space of reaching burnout will get delayed by a majority time.
Thank you, ma'am. Thanks for the wonderful answer. Next, I would like to move on to Aprachita, ma'am. Ma'am, during MBBS and during post-graduation, we might be coming across difficult seniors. And how do you think we should handle them? Because we cannot avoid them till our course is ending. So how do you think we can handle them? And what is the best way to keep them happy as well as keep ourselves happy?
Thank you for the question, Dr. Venkatesh again. Yes, we all of us, we do get difficult seniors at times, although most of the times I would like to say they are helpful too. But then yes, we do get difficult seniors time and again. So I, from where I stand, or from what I have learned in these last few years, is that patience is the key. Patience is the key to absolutely everything. So you have to understand their perspective. Like everyone, there's someone sitting above you, doesn't matter it's the resident, third year resident, or the senior resident, or whoever. So this thing that they, it comes down to the senior resident, they'll start screaming at the third year resident, then they'll again, it'll boil down to the second year. So handling them can be very tricky because you have to work with them till the end. And I think yes, you have to be very patient. If they are not telling you something, if they are screaming at you, I'm not asking you to just stand in their shoe or just understand their perspective. No, it is very difficult to do that at that point. When someone is screaming at you and there are other people around you, it is difficult. But yes, just be patient and listen to them. That's what all of us do, right? As residents, you listen to them, then you go to your friends and you talk to them, and then you're like, this happened, and then second day, the next day, just forget about it. Do not hold grudges. See, if you hold grudges, or if you keep holding on to those negative feelings or those things, that if they are, they'll eat at you, they'll keep on eating away at you, and you won't be able to work properly. If you don't work properly, you'll again get scolded. You won't be able to concentrate on your studies, on your work, nothing. So rather just let it go. Just let it. It's easier said than done. I totally understand that. But then you have to let it go, because as residents, we don't really have another option. Or if second best thing that you can do, that I have tried, is communicate. After everything has rested down, communicate. Ask them if, sorry, if you were wrong somewhere, if you were wrong, to teach you. And next time you do not repeat it. And even then, if you accept your faults and if you say, yes, I'm sorry, this happened, even they'll understand you. So communication is again the key. Communicate whatever feelings you're having. Like I have a junior resident here, and there are one of my colleagues, she said something she shouldn't have in that moment of heat or whatever. So there was an outburst. So but then they talked and she said that, ma'am, I'm feeling so and so. And I think communication and patience is the key to everything, from what I have learned in these few years. So that's how you go about it.
Thank you, ma'am. Thank you. I totally agree to what you say. I would like to know the I would like to ask Shanki Kumar ma'am to share her viewpoints for this question. How to handle difficult seniors?
I think, like ma'am rightly said, communication continues to be the key. Just remember one thing. If you don't say what you want to say to the person who you want to say it, you will talk about it to five different people at five different times. So you will replay the incidents 25 times in your mind by talking to every friend, saying this person did this person said that. And it will, one important thing to realize is that when you're actually saying something and when you're thinking about it, it releases the same hormones in your body. So if I'm thinking about something bad, when I'm communicating it, I'm releasing the same stress hormones in my body as when it is happening to me. So when you communicate it clearly, you're venting out, you're clearing that glass so that there can be more water inside. And follow the steps of communication. Step one, like follow these three simple steps of communication, because you don't want to be perceived as an arrogant person. You don't want to be perceived as a difficult person as well. You have to work with your seniors. You have to work with them and have a harmonious relationship. So the three simple steps of effective communication would be: step one, first of all, appreciate something that they must have done. Don't let this one incident paint the entire picture that, okay, they're rude to me or they're bad to me. First of all, communicate an instance that I really liked how you supported me in the past when you did this for me. But I would like to say that this time when this happened, it really impacted me. I think we could have handled this way. And step three, maybe you can suggest an alternative solution for it. That, ma'am, I would really appreciate, if we can talk about it alone. I feel kind of hurt when it's pointed out in front of the whole team. And then I feel really bad about it. So if you start from appreciation, then you point out the problem, then you give a solution. These three steps are for effective communication. So you're able to achieve something from a communication. Because your senior is not just like a friend with whom you're venting out. It has to be professional and it has to be done in a balanced and mature way. But please communicate. If you keep it inside for longer, sooner or later that volcano will burst. It will give you stress and anxiety. So effective communication continues to be the key.
Thank you, ma'am. Thank you for the clear explanation. And next, I'd like to ask Rafia Khan, ma'am. Ma'am, as you know, as we all know, anesthesia is one of the branches where there is high risk of getting a lawsuit. So, how to face these threats of medical legal cases, ma'am?
Thank you for the question, Dr. Venkatesh. I think as ma'am has rightly said, and of course Dr. Bhushan sir has rightly said that communication is one of the very important keys in anesthesia as well. In fact, for that matter, any medical legal purposes. And as sir has already mentioned that we as anesthetists also, prior to taking up any high risk case, we explain the attendance, and of course we take in written also, like the usual procedure. And if there is any attendant who's very what should I say, not ready to accept complications, and not able to understand, not understanding the risk, and not giving consent, and but it's really important, but the procedure is important, then one thing we simply say, it's all right, then okay, fine, then you, if you want your patients, you don't want your patients to get treated, it's very simple. We try to explain in as simple words as possible in their language, but still if they're not able to understand, then it is their choice. See, we cannot force anybody to undergo any procedure, any risky procedure. Of course, it's their relative, it's their family member, we cannot impose anything on them. It's their choice, they are coming to us by their choice, they have this problem and we are offering them the treatment. And if they are not able to understand the complications, the consequences, even in the most simplest languages, we can explain to them. We are explaining them even the risk, the percentage of the risk involved. But still, if they are not, then it's very simple. It's their choice. If they want to abandon, they don't want the patient to get operated, or they don't want the patient to undergo any procedure in ICU. So very important thing for all medicos is getting consent done, and usually it's very difficult for the newcomers, the first year residents, for make the attendants understand. So it's just a suggestion that it would be better that for our ease, at times we ask our first years to, okay, jao bhai tum samjha do. They're newbies, so they don't know how to communicate, and this may create miscommunication between the attendants and the patient and the doctors. So it's better, since they're in their learning phase, they are, of course, they can make mistakes, but why in such critical situations, in such high risk patients, it will be always better that some senior person go explain, and that junior resident should stand there, try to understand, try to make note of the kind of words, because we cannot be very upright and upfront in using very straightforward words. We need to be very polite with them. Of course, they're suffering from a trauma. They're undergoing a lot of stress. Their patient, their family member is under a lot of stress. It's disease. So it's very important that a senior person goes and takes the consent and explains the attendant, just for the easiness, and just everything shouldn't be left on the junior resident, I would like to say. And of course, getting in written, it's very important these days, because it's the only thing that you have in hand.
Agreed, ma'am. Totally agree to it. Next,
Yeah.
I would like to ask Divendu sir. So, how do you see PGs, postgraduates resigning from their courses and going out of the college due to the unfavorable environment there? What do you How do you see that, sir?
Uh, this is very unfortunate if someone someone leave his post-graduation in between the course. Like, it is very unfortunate, whatever the branch is, whatever it is, non-clinical, paraclinical. At this age, I am around 15 to 16 years postgraduate, and I can say that anatomy is as important as medicine. Physiology is as important as medicine. Yes, I agree with the point that no one in this world do medical profession to become an anatomist, to become a physiologist. I agree with that, but it is the duty of the our senior members, our say course organizers, to tell them what is their future prospects, what is good there in all branches, what is the good part of that. Everyone is doing their part and everyone is very important. At this point, say, Venkatesh, I can say that every branch has their, it is so beautiful branches. The pathologists are doing so much very good work. Microbiologists are doing, you yourself, there is in a community medicine. At 20 years back, it was considered that, oh, community medicine kaun lega, but now it is a hot cake. People know what is the good in thing. So this is the responsibility of the HODs or senior persons to show the new people coming in, newcomers, to show the good effect, good things in their profession, in their branches, कि ये इसमें good है. और अगर if somebody is leaving for the because of the work stress, so again, see, this again is the part of the senior professors, HODs, or faculty members to see that which post, everyone, as the madam has said, everyone has different stress level to deal with them. So to recognize them, to recognize that who can deal with this much of work, we have to promote them. Yes, you have to do it. Sometimes it can happen that you have to you can have sleepless nights. You have to wake up for the patient. There are, आजकल तो नहीं होता है, लेकिन हमारे टाइम में हम लोग, we used to do ambu for a snake bite patient because we know that that patient can come out next day. That smile is never forgettable. That is the beauty of medicine. When the one patient, when you treat a patient and he will go say bye when he was going, then you feel very good. That essence cannot go. So I don't think that pathologist or microbiologist should be so much underconfident or so much sad that nobody say thanks to me. So somebody who is giving thanks to me, to a physician, to a surgeon, he is giving thanks to all the departments. So we have to encourage this, and we do this. We give thanks to all the branches. So it is important to recognize the good part of every branch. If somebody is there in the stress, even in the clinical, any branch, it is the duty. Definitely, it is the duty of the faculty members to recognize it, that person is in stress, and then give him some tips to handle with it. Organize some CMEs, organize some cultural activities, organize some extracurricular activities, go for the dinner, do some say cricket match, whatever the things we can do to rejuvenate that person. We should know that what were the good things in that PG. He used to make good drawings. Let appreciate it someday. Let appreciate it that you make so much of good drawings. If somebody takes good histories, tell them that yes, you make good. You used to give the good histories. So you have to appreciate them. You have to give appreciation. You have to give the reward them when they do good. They are just like our kids. So we have to treat them like this. I don't think so. If we take care of that, they will even will somebody will leave the course. No.
Thank you, sir. Thanks for the elaborate answer. So, due to lack of time, we'll take the last question from the audience. Dr. Aravind Kumar has asked, what happens if we ignore stress? Shanki Kumar ma'am, can you please share your views on it? Ma'am,
So, yeah, thank you for the question. I think one important thing to remember, like you saw in the presentation, When initially stress happens, look at it like a normal probability curve. The initial stress that happens to you, that's good for you. What Sir was mentioning, that's what I call the U stress. A stress that's important for you to be productive. Remember how we all felt before our exams? That's something that would push us to do more, do better. That's the initial part. The moment it rises from there and continues for 2 or 3 weeks, that's when our performance will completely go down. If you ignore stress, if you let your body be in that anxious space for a very long time, it will start to impact first your mind, then your body, and all your physical symptoms. One of the first things that you're going to see is your sleep pattern will become bad. You'll not be able to fall asleep. You'll keep waking up. Despite getting sleep, you will not feel rested. You will either stop feeling hungry, your appetite will either reduce, or your appetite will increase a lot. You will try to really eat a lot of food to comfort, which might further lead to physical problems of obesity and other health issues going forward. Another thing that you will notice is all the systems of your body will go under stress. You will notice that, like, a lot of symptoms of stress and anxiety would be feeling like a heart rate increase, feeling like I start shivering, I get sweaty hands. All these things happen if your stress goes onto a scale of 8, 9, and 10. If you still don't address it, you will have difficulty in doing the normal basic functioning activities of the day, which is getting up, taking a shower. You will start noticing a reduction in your focus and concentration. And it's like you are putting so much pressure on yourself that all the functioning systems will collide. So rather than just looking at this answer as what are the ways it will impact our mind and body, I would like to extend it further and be like, please be very conscious. Please check the way you have that kindness for other people. Have that kindness for yourself. Will you do that self check-in? How am I feeling today? Am I feeling okay? Am I feeling fine? And if you are on the scale of 0 to 10, a 4 or a 5, take an action there. अगर आपका प्रॉब्लम इतना छोटा है तो इतनी जल्दी ठीक हो जाएगा. अगर आप उतने प्रॉब्लम को इतना बड़ा करके ठीक करने आएंगे तो उतना ही लंबा टाइम लगेगा. So let's be very proactive about it. Let's use everything that we've learned to imbibe in ourselves. And I think one of the more important things is, that they say 70% of a child's learnings come through observation. And we continue that even growing up. I might be talking to you about something and you might take 30-40% of it and forget the rest. But if I do it with you, in front of you, you will automatically start imbibing it. So if all of us and all the people listening start inculcating these little reminders, all the fellows, all the residents around you will also practice it.
Thank you,
That's
ma'am.
what I'd like to say. Yeah.
Thank you, ma'am. Very well explained. Now I would like to request the National Joint Secretary of IMA Junior Doctors Network, Dr. Shankul Dwivedi, to give the closing remarks.
So thank you, Dr. Venkatesh, for inviting me over. And it was a wonderful session to begin with. And I record my sense of gratitude and thankfulness to all the esteemed panelists who are present with us today. They are stalwarts in their fields. And it is utmost important to notice and let us acknowledge that they have taken very important time out of their precious busy schedule, and they were here. It really means a lot. It is we take it very lightly that seminar is going on, but these expertise, these suggestions, and very nicely picked up questions and the answers to them, magic remedies. These are little things, small steps, as said by someone, and you have to make them counted all over for your life. So I would like to thank Professor Dr. Rajendra sir, Dr. Devendu Bhushan sir, Aprajita ma'am, Dr. Rafia ma'am, Shanki Kumar ma'am, and the convener of this, Dr. Rohan Krishnan, and our moderator who has done wonderfully well to micromanage all these things and bringing us together at this platform. And importantly, also all our audience who have joined us through various platforms and those who have benefited from this session. We are very sure that this series of these lecture series are on mental health and for all of us. I thank everyone for being here with us today. Thanks a lot.
Thank you so much, Dr. Shankul. Once again, I would like to thank Dr. Divendu sir, Rafia Khan ma'am, Aprajita Singh ma'am, Shanki Kumar ma'am, and Dr. Shankul, plus our 300 and plus registered participants for making this panel discussion a fruitful one. Hope the healthcare workers, especially doctors, start focusing on their own mental health from now on. Thank you so much, everyone. We are closing now.
Thank you so much. Also, we are closing here.